do a exercise that can help people get out of back pain. I'm gonna do an exercise that can help you get out of back pain by using your hamstrings, which are in the back of the leg. They're gonna help tilt the pelvis back, because for most people that do have back pain, their pelvis is tilted too far forward. Since these hamstrings on our back, they attach at our pelvis here, they help pull our pelvis back. And the other muscles that help do that are the obliques, that also from the top, attaching to the pelvis, pull that pelvis back. So this exercise is designed to work the hamstrings, the obliques, and our diaphragm as well, that we're going to be using the balloon with. And the reason why we need to work on the diaphragm is because oftentimes these hip flexors from sitting so much get so tight they pull our pelvis forward here, and that can lead to compression along the spine. As the pelvis goes forward, the spine also extends, and then it can cause compression onto the discs and onto the nerves there. So basically, if we activate the diaphragm, or our main breathing muscle, that's going to help turn off those hip flexors too. So that's what the balloon is for. I'm going to show you how we'll do this. And our first initial setup is going to be in the seated position, but lying down with your legs on top of you could use a couch, a chair, a bench. It doesn't really matter, a coffee table, as long as your feet are secure right on top. And what our legs are going to be doing is pushing straight down, not forward at all, and not back towards us. It must be straight down. If you don't do it straight down, you're either going forward or backward here. You are not gonna help the pelvis nearly as much as you can be if you just focus on going straight down. The other thing that we're gonna do is we are going to have in between the legs, you can use a towel, a rolled up towel. You have a roller, a little bit thicker couch cushion. I would recommend at least 3, 4, 5 inches here. This roller is probably, half the size of my hand. We're gonna squeeze this roller. Legs are driven straight down here, okay? And my back is flattening into the ground. That's gonna help engage my obliques. We're only gonna do those 3 things, again, straight down, squeezing, back flattening, when we're exhaling, and we're gonna pause at the end of the exhale while we keep doing those things. When you inhale using the balloon, you're gonna relax everything. You're not gonna be pushing down. I'm not really gonna be squeezing this. I don't need to flatten my back here. But when we relax and inhale, that's gonna really activate that diaphragm. So, upon inhaling, I want you to have the balloon in your mouth. Take a big breath. Here's a few pointers. When you are exhaling, keep the tongue on the roof of your mouth. Otherwise, this will happen. right after the exhale into the inhale, if your tongue is not on the roof of your mouth, the air is going to go back into your body, and you're not going to be able to keep the balloon filled up. Another thing that a lot of people may not realize that they're doing incorrectly is breathing. When you inhale, your stomach needs to expand here, and your chest needs to also expand. Both stomach and especially the upper chest needs to expand. So when you're doing this, when you're breathing in, what I would recommend when you first begin blowing up the balloon, don't worry about your legs, don't worry about squeezing, don't worry about you flattening your back. Make sure first that your stomach is expanding like this. The stomach needs to expand. If it's not expanding, you're going to have to kind of force it and make sure that it is expanding up. The other thing that you have to do is make sure that your upper chest is expanding and both your left and your right chest are expanding up like this. I'm going to move my arm up here so you can hopefully see my chest expand. But remember, your stomach and the upper chest need to expand whenever you inhale. When you exhale, they need to both go down, ribs go down. And that is the basic 90-90 hip lift, popularized by Postural Restoration Institute, extremely effective in helping people who have both pelvises tilted forward. Give it a shot, let me know how it feels.